welcome. My name is Dr. Chris Williams, and I'm your host on Well Again. Well Again is your online health magazine channel, and the program in which we discuss lifestyle alternatives to living in health, retaining health, and regaining health from sickness. You're welcome. All right, today we want to talk about hypoglycemia. But before I continue, I would like to encourage you to subscribe to this channel and make sure you turn on your notifications so that you get notified of any other videos that we do in the future. Also, we also do trainings, and that's very important. We do trainings, and we do trainings second week of the month, from Wednesday to Friday, morning to roundabout afternoon. We do trainings. And if you are living, I stay in Lagos. If you live outside of Lagos in any part of the world, the training can also be captured. You can join us via Zoom, and at the end of the day, you can you'll be satisfied, you'll be empowered to help yourself along the lines of health and also help people around you. You are welcome. All right. Today we are talking about hypoglycemia. And hypoglycemia is simply low blood sugar. We want to talk about chronic hypoglycemia. When somebody keeps having a recurrence of hypoglycemia and it has lasted for a long time, it is cause for concern. All right. So normal blood sugar is normally between 80 to 100 milligram percent. All right. So if somebody has eaten maybe 2 hours back or even 5 hours back, by the time you measure their blood sugar should be between 80 to 100 milligram percent. Okay, and then it can even be more. Actually, especially towards the 2 hours after eating, you could get 100 and something, in excess of 130 or whatever. Okay, but by like 5 hours thereafter, you get about 80 to 100 milligram percent. Now, if you begin to get anything lower, especially you are now getting 60, you are getting 50, that is hypoglycemia. And if that occurs regularly, then the person has need for some attention or the other. There are two types of hypoglycemia. There's reactive hypoglycemia. That's the one in which the blood sugar drops to the levels that we talked about between 2 to 5 hours after eating. Okay, and so that's reactive hypoglycemia. The person begins to sweat, they begin to have tremors, they begin to have rapid heart rate, and then they begin to be anxious, and more importantly, they are hungry as if they have not eaten in 2 days. Okay, the cause of this is over secretion of insulin. Okay, they are in some kind of metabolic syndrome. There's a chain in their body, there's a system in their body that is amiss, and they begin to have issues. Okay, so there's the pancreas. You know about the pancreas. The pancreas secretes insulin, and insulin has two jobs. Number one, to escort the glucose across the blood cell barrier. Okay, it takes the glucose from the blood and escorts it into the cell. That's number one. Number two, when there is low glucose in the body, insulin will prod the liver to produce more glucose. All right, so that's normally what happens. However, that's normally what happens. However, somehow the pancreas in this situation is not working optimally. Okay, so there is some kind of insulin resistance. Insulin is not able to do its work, so the body adjudges that, interprets that as lack of insulin. I mean, if there are police everywhere and there's robbery everywhere, that means the police are not there or they are there but they are not active. So they what to do is to maybe recruit more police or something. So that's exactly what happens. What insulin is supposed to do, it's not doing it. So the body goes around, goes ahead recruiting more insulin. So after some time, there's plenty, lorry loads of insulin in the system, and this can lead to a sharp drop in the blood glucose, reactive hypoglycemia. All right. There's also fasting hypoglycemia. When somebody decides to go on a fast, maybe 8 hours fast, and then they go into such levels of hypoglycemia that there is a cause for concern. Maybe they are almost unconscious, or they are, such levels of hypoglycemia. Maybe the blood sugar begins to go around 50 or even 45 milligram percent. Now that is a cause for worry. It's not normal that somebody's blood sugar should fall that low, just not having eaten in 8 hours. Okay, that means that second function of the insulin is not being done. You remember the second function? I said there are two functions of insulin. The first one, insulin escorts glucose from the blood into the cell. Secondly, when there's low glucose and the person has not eaten in the blood, because the person has not eaten, insulin will challenge the kidneys to go into glycolysis, and then the livers begin to break down, release more glucose into the system. Now that second, in fasting hypoglycemia, the liver, that glycolysis, breaking down of glucose by the liver and replenishing the blood with it, is not functional. So there's some kind of chronic liver disease or the other. That's in fasting hypoglycemia. What are the general symptoms of hypoglycemia? Fatigue, dizziness, palpitations, nausea, blurred vision, lightheadedness, headache, irritability, fainting spells, depression, nervousness, anxiety, cravings for sweet things, confusions, night sweats, weakness in all the legs, swollen feet sometimes, lightness and tightness in the chest, constant hunger. This person is constantly hungry, pain in all the different parts of the body, nervousness, and then nervous habits, and anxiety. Sometimes it can even be aggression and mental disturbance and insomnia. I mean, there's a battery of symptoms that accompany hypoglycemia, and that's why it's difficult to actually diagnose hypoglycemia, because it presents like many other sicknesses. It mimics many other sicknesses: adrenal dysfunction, allergies, asthma, chronic fatigue syndrome, all kinds of things, renal disease, liver disease. It mimics so many things. So that's why it's difficult. All right, but so usually hypoglycemia will be arrived at after all these other diseases have been ruled out. All right, so what are the causes of hypoglycemia? There are quite plenty. Eating large quantities of simple sugars. Some people just like abusing sweet things. They drink soft drinks, they drink carbonated drinks. They are all over, eating a lot of simple sugars. They eat a lot of sweet fruits, especially the fruits that we have these days that are basically genetically modified. Some people don't know the fruits you have now is not the fruit that your great grandfather had. Neither is it the fruit that our forefathers had. They have tampered with them, they have genetically modified them, they have increased their sugar content and out of proportion. So abuse of simple sugars. Some people, all kinds of things. Number two, abuse of alcohol and caffeines. abuse of alcohol and caffeines, addiction to all those things. Okay, and then eating insufficient amount of complex carbohydrates. Remember, we said eating large quantities of simple carbohydrates, and that's simple sugars, either as glucose or as fructose, and then eating insufficient amount of complex carbohydrates. Complex carbohydrates are the ones that are ideal for your body, that your body breaks down little by little to produce the required glucose in your body. But some people get to the point where they don't eat it sufficiently because maybe they are dieting or they are doing keto diet or something very funny, where they tell themselves no, not to eat carbohydrates again. You are just going to destroy your body. Your body is going to get confused, and you are going to begin to suffer hypoglycemia after some time. High stress levels. Okay, hypoglycemia can also be hereditary, can be genetic. Inadequate eating, we have talked about that. Adrenal insufficiency, thyroid insufficiency, pituitary disorders. Okay, kidney diseases, pancreatitis or pancreatic tumor can lead to hypoglycemia. Candidiasis, overwhelming candidiasis can also lead to hypoglycemia. Okay, and then chronic liver disease, we've said it, and then of course diabetes. Diabetes can also lead to can also cause hypoglycemia. Now that looks like a paradox, because diabetes is supposed to be hyperglycemia, plenty of sugar in the body. But especially there are two occasions in which diabetes can come along with hypoglycemia. Number one, when it's just starting, when your body is still trying to regulate itself and attack what is happening. So the body begins to secrete insulin in a condition called metabolic syndrome, and then that oversecretion can lead the blood glucose to be down. Also, when people are taking oral hypoglycemic drugs without regulating it, in taking your oral hypoglycemic drug, you must keep a tab on your fasting blood sugar. All right, and then your doctor must work with you to know when to reduce it or when to increase it and all that. Okay, so those are the things. Now, what should you do? What should you do? Number one, remove processed, refined foods from your table. Very important. Pastas, pastries, macaronis, noodles, remove them. Flours, remove them. And everything made out of flour, pastas and pastries, confectionaries, remove them. Remove dried fruits. Reduce your salt intake, especially replace your normal table salt with Himalayan salt. Okay, and then also soft drinks, remove them from your food. Okay, also remove artificial colorings and flavorings. All these things damage your body. They damage your body, and then you begin to suffer hypoglycemia after some times. Also, reduce drastically or remove meat proteins. Chicken, beef, turkey, remove them. Eggs and milk, remove them. Milk is known to be one of the foremost causes of food allergies in the body. Remove them. You can do fish, do it little. Do especially wild fish that is in the wild, that is not farmed fish, and then do the dried variety. Okay, or when you get it, you dry it by yourself, and then before you eat it little. Okay, so avoid sweet fruits. Very important. Some people think that they are practicing health by the time they are blending or juicing pineapple and drinking it every day. You are just destroying your health, because those things, number one, are not the way that God created them. Their sugars have been genetically increased, and then secondly, okay, by the time you blend stuff and you juice them and you drink them, you get a whole lorry load of sugar into your system. All right, very, very important. Okay, stay away from fatty foods and frying generally. And oils that are saturated oils, stay away from them. Okay, you can use only canola oil. You can also use olive oil. Okay, and then don't eat heavy foods. Don't eat heavy. Don't sit down and eat heavy. Okay, if you are dealing with hypoglycemia, all right, don't sit down and eat heavy at a time. It's better that you eat in smaller quantities, maybe like 4 times a day, very little smaller foods. Is better than for you to eat heavy, because once you eat heavy, you remember we said either your pancreas is having issues or your liver is having issues, one way or the other, or your adrenals are out of sync with the old system. So you don't eat too heavy. Eat little. You can now increase the number of times you eat, maybe to like 4 times a day. That will be very, very good. Okay, so if you must sweeten anything, sweeten with stevia. Stevia is a plant, it's a natural plant. It has a bitter aftertaste. You can do that. Okay, so what other things should you do? Eat high fiber foods like beans, like flaxseed, like grains. Those are the things you should eat. And vegetables generally: broccoli, cabbage, spinach, lettuce, cabbage, beetroot. Vegetables, you can blend this and drink them. Okay, they are very, very good. Spinach, artichokes. Okay, you can also eat beans and lentils. You can eat beans and lentils, and then you can eat brown rice. Brown rice is very high in fiber. You can eat it. You can eat soya products. You can eat them. You can eat avocados. You can eat bananas but don't eat it too much. Okay, and then we've talked about eating fish and grains and nuts and seeds. Okay, very, very important. Now, okay, don't eat large foods. We have talked about that. During hypoglycemic attacks, people have come to me and said, doctor said when I'm having it, I should take a bottle of soft drink. That is very, very wrong. You are adding to the problem, actually. If the attack is not an emergency, as in you are almost fainting, okay, eat some complex carbohydrate. You can eat beans. So if you are having incessant attacks of hypoglycemia, carry a flask of food around, and then if you are having it, you can stand up and then you can eat. You can stand up and you can eat it. Okay, you can dish some and then you eat it. It's better than taking soft drinks. It's better than taking soft drinks. Also, eat a lot of fibers. Eat a lot of fibers. I mean, take pleasure in eating fibers a lot. And some high fiber foods are flaxseed, psyllium ox, and oat bran. Also, rice bran is also very high in fiber, and coconut also. Coconut is very high in fiber also. Eat a lot of avocados. Avocados, I mean, does wonders in management of hypoglycemia. And then be on some supplement that will help you to rejuvenate your adrenal gland. So be on some adrenal support supplements. All right, and then also B complex, high doses of B complex plus extra B1, B3, B5, B6, B12. Okay, high doses of B complex. Then also be on some liver extracts supplements. Okay, they're also very good. Or liver support things, they're also very good. Milk thistle is very, very good in enhancing and helping the liver. Milk thistle, glutathione, and acetylcysteine, and then alpha lipoic acid. These are very good in rejuvenating your liver. All right. Chromium also, chromium picolinate. Chromium is very good in management of sugar metabolism. Chromium is good, about 200 is a milligram or microgram now, I forget. Okay, quercetin also. Quercetin is very good. It helps to manage allergy situations, and if there's a tumor, it helps. Pancreatin helps you to better absorb protein. Okay, it helps you to better digest protein. Okay, and then zinc is needed for proper release of insulin, L-carnitine and L-glutamine. Okay, so calcium and magnesium also. In fact, almost routinely, I place folks who come to us on CalMag Zinc. Okay, and it's very good. Those three, you really need them in your body. They help to stabilize a whole lot of things in your body. Okay, if you can get a supplement that contains manganese also, it will help you. And then of course, good old vitamin C with bioflavonoids. All right, so what are the herbs that are helpful? Bitters generally, so something like bitter leaf, Vernonia amygdalina, and then bitter cola. They help you to manage blood glucose because they help the kidneys. Actually, anything that's bitter helps the kidney. All right, and then you need a whole lot of anti-stressors like chamomile, like passion flower, like hibiscus, or like lavender. Okay, you need them, skullcap, all these things, valerian, you need them. They help you manage stress better, because stress, like we said, is one of the foremost causes of chronic hypoglycemia. Dandelion, burdock root, milk still, peppermint. If you can get a preparation that contains this, they help your liver so very, very well. Echinacea can also help in case there's candida infection. Okay, there's candida infection, echinacea can help, but don't take echinacea more than 3 months at once. Other herbs that can help are podako, yova or C, and then reishi. Reishi is really very useful in helping you to adapt to stress. Spirulina and other like chlorella, they help you to, they are very good protein supplements. They help you, they help to supply good protein in your body. Don't forget, we said adrenal support and thyroid support. All right, thank you so much. I will not be able to go beyond this. My time is almost up. So do not forget to subscribe and then turn on your notifications so that you can get good notification concerning this when we release new videos. Also, you can follow us on Facebook. We're also on Facebook, and then our program is on Dove Television. It's also on WAP TV. Okay, WAP TV 8:30 a.m. Monday morning, and Dove Television 7 p.m. Monday evening. You can follow us. I mean, we're just teaching, talking health and helping the people of God. All right. If you also need to place adverts here, let us know, and then we can make such arrangements for you. All right. Don't forget our training every second week of every month, Wednesday to Friday, Wednesday, Thursday, Friday, second Wednesday, second Thursday, and second Friday of every month. There we can do a training. It's a paid training, and then if you 3 days intensive, at the end of the day you get some kind of certification. Okay, you are empowered with more knowledge concerning health that will help you understand your health better and help you to help people around you. All right, and then if you're interested in making doing business around our products and services, we can also discuss. All right, we also are into real estate. We are developing a property, an estate right now, and then it promises to be top notch actually. And if you are also interested, or you know somebody who is interested in getting a property that is secured and that is well planned, okay, and then it will have some of these our health considerations there, you can also call us. Before long you see the adverts concerning them on our channel. Now our books are still available. Reversing Depression Naturally is still available. Reversing Diabetes Naturally is still available. Sickness Free Fail-Proof Protocol for Regaining and Retaining Health is still available. And then we also have the book Living a Disease-Free Life by Daniel Ekele, and also Make Your Food Your Medicine by Itoro F. Young Bright. Thank you so very much. Till I come your way again. Bye-bye.